Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an informative and exciting show for you this evening. We're talking about melanoma and skin cancers, and we'll be discussing what services are best suited for patients when determining their care. We'll be joined by a panel of medical experts from dermatology and oncology. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at melanoma and skin cancers with St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Dr. Melissa Wilson. She's a board-certified, fellowship-trained medical oncologist and director of the St. Luke's Melanoma Program. Dr. Wilson treats cancers of all types and has extensive experience with metastatic melanoma. She served as principal investigator on several research projects focused on melanoma, and her work has been published in many medical journals. Together with the team at St. Luke's Cancer Center and the Department of Graduate Medical Education, Dr. Wilson will be leading the development of the St. Luke's Hematology Oncology Fellowship, slated to begin in July 2022.
I really enjoy taking care of my patients. That's my favorite part of my job. I'm Melissa Wilson, and I am the director of the Melanoma Program, and I am the director of the Hematology Oncology Fellowship Program. When I see patients, I really start from the beginning. I collect a history, talk to them about their experiences, what led them to actually getting to my office. When they do well, we celebrate the highs, and obviously not everybody does great, and so I'm there with them through the lows, and it's really just a journey that we take together. I'm really excited to join St. Luke's as the program director for the Hematology Oncology Fellowship. We're working on developing this new training for internal medicine doctors to then focus on cancer related to blood disorders as well as solid tumors. I think what this really offers is a unique training opportunity for internal medicine residents who want to either stay in the area or come to the Lehigh Valley and really gain the knowledge that they need to then be successful in their career.
Thank you so much for being here, Dr. Wilson.
Thank you.
What propelled you to focus on skin cancer, specifically melanoma, when you started your career?
So when I was a medical oncology fellow, we rotated in a bunch of different cancer clinics, and I had a melanoma clinic. And I just was really fascinated by the disease, by the patient population. And so I felt with my research background, it would be the great field to make a big impact for patients and patient care in terms of patient care itself as well as research.
I love that your decision was so patient-centered, so thank you so much for being here. Joining our panel next is the chair of dermatology, Dr. Andrew Krakowski. Seeing patients of all ages, from newborns to the elderly, he treats skin issues ranging from acne, eczema, warts, scarring, and psoriasis to basal cell carcinoma and melanoma. In addition to seeing patients, Dr. Krakowski also oversees the dermatology residency program at St. Luke's. Working collaboratively with other specialists, Dr. Krakowski provides patients direct access to reconstructive and plastic surgery, specializes in scar imaging studies, physical and occupational therapy, and scar-specific trauma.
I'm Andrew Krakowski. I'm the network chair of dermatology and the program director for the residency in dermatology at St. Luke's University Health Network. As a pediatric and adolescent dermatologist, I really see a wide spectrum of conditions, ranging from newborn to about 18 years of age. Almost always, we are able to improve the lives of our patients. What's wonderful about treating the skin is that you can make an immediate impact for your patient. You can make a diagnosis right then and there, and you can give your patients what they need to get better, starting the moment they actually walk out your door. When you as a patient come to St. Luke's University Health Network, you're not just seeing a single clinician, in my case, a dermatologist. You're seeing an entire network of clinicians, people who have dedicated themselves to making sure that you get the best care possible. It's critical that we have access to a multidisciplinary team so that we can get different perspectives involved and optimize the care for our patients moving forward.
Dr. Krakowski, tell me a little bit about what St. Luke's Dermatology offers patients and why it's important for people to see a dermatologist in the first place.
When you come to see us, you're coming to see an expert board-certified dermatologist who's there to give you the most up-to-date advice on your skin. You're getting access to some unique cutting-edge technology and hardware that you can't find anywhere else. Yes, you're coming to see a dermatologist, but you're also coming to be supported by an entire network of clinicians, also non-dermatologists, who want to care for you from head to toe and from body to mind. Your skin is the largest organ of your body, and you really owe it to your loved ones to get checked out so that we as dermatologists can help keep a small problem from becoming a big one.
Thank you so much, Dr. Krakowski. It's amazing how important that screening is on so many parts of our body, but certainly, as you mentioned, our skin, largest organ. So thank you for being here. Let's meet our final panelist, Dr. David Andolino, a board-certified radiation oncologist. His practice encompasses all types of malignancies with a specialization in head neck cancer and breast cancer. As part of a multidisciplinary group, Dr. Andolino works with physicians in various specialties to provide seamless, thoughtful treatment customized to the needs of each individual patient. His number one priority is to make sure that patients fully understand how radiation works, how it can help treat their cancer, and how the staff will help them manage any side effects that may be related to treatment.
My name is Dr. David Andolino, and I'm a radiation oncologist here at St. Luke's. Radiation is a rather scary thing for a lot of people, so a lot of what we do when we first meet patients is try to explain things fully so they're informed exactly what we're going to be doing, how the radiation works, and just try and put their mind at ease that, we're doing this to get rid of cancer and, make sure they know what side effects to expect, but try to have patients be comfortable with the overall plan and put their mind at ease regarding the radiation, because again, they're typically rather scared when we first meet them. I think the new dermatology department is a real benefit to the network because dermatology in general in Lehigh Valley, there was a bit of an access issue. So now I can simply walk them upstairs to the dermatology department, and it's really, I think, a benefit just for the St. Luke's community to have dramatically improved access to dermatology in Lehigh Valley. There are many rewarding aspects of what we do, but the obvious one, so to say, helping people get healthy and get on with their lives and hopefully forget about, ever having radiation treatment.
Welcome, Dr. Andolino. Can you tell us a little bit about your role as a radiation oncologist and how does that factor into a skin cancer journey? What do people need to know about what you do?
First off, not everyone who has skin cancer will need radiation. In fact, most people with skin cancer will not need radiation, but there are certain scenarios where myself as a radiation oncologist, meaning an oncologist that uses radiation to treat a cancer, would be involved. There are times where maybe surgery is not an option or there's not a good systemic option, and we'll use just radiation to get rid of the skin cancer. Not every patient with a cancer will be referred to a radiation doctor or radiation oncologist, but there are many scenarios where, we may come into play as a treatment option.
Thank you for explaining that. We look forward to learning more because I think it's interesting for people to hear that needing to see a radiation oncologist does not always mean that you're in trouble. You can help in a lot of ways. So thank you for being here, Dr. Andolino. Thank you all for giving us some background information on your expertise with melanoma and skin cancer. But up next, we're going to dig deeper into the basics of skin cancer and what that entails. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now. Staying home but still need to see your doctor? Schedule a virtual visit with your St. Luke's doctor or specialist for all your healthcare needs. Easily access your appointment from your smartphone, tablet, or computer. Your doctor will be able to assess your needs and even send a prescription if necessary, all in one quick session. Call your St. Luke's doctor to schedule your virtual visit today. Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching tonight and for providing us with questions to the panel before the show began. Joining me is a talented panel of medical professionals, Dr. Wilson, Dr. Krakowski, and Dr. Andolino. We've started to discuss everyone's background and expertise in this field, but now we want to talk about the basics of melanoma and skin cancers. Dr. Wilson, we hear the term melanoma, but there are a lot of different types of skin cancers. So what's the main difference between a melanoma and other skin cancers?
What differentiates the different skin cancers from one another is the cell type of origin where the cancer arises. So basal cell and squamous cell skin cancers are the most common, and those arise from those parent cells. So there are basal cells in our skin, there are squamous cells in our skins, and then melanoma arises from the cell in our skin called a melanocyte, which is the pigmenting producing cell in our skin. So when patients or people are out in the sun and they get a suntan, that is the pigment melanin that gets activated and turns brown.
So really, it's a type of skin cancer. It's just determined by the type of cells that come to the surface that you're looking at.
Correct.
Okay. So Dr. Krakowski, when you are looking at a patient, they're in for their annual skin checkup, what are you looking for, and can things really change that much year to year?
So I'm a board certified pediatric dermatologist as well as being an adult dermatologist. So I see children down to newborns. It's very rare. It can happen, but it's very rare that a child will have melanoma. In an adult patient with a known history of skin cancer, we have a very sort of planned program for having you come back just to make sure that we don't miss a skin cancer that we know can sometimes happen very soon after the first one's identified. For the general public, though, who are just walking around without much of a risk for skin cancer, there's not a real demand to need to see us on a year-to-year basis. But what we do encourage is that you or a significant other help you. You can have some fun with it at home, to look at your own skin at least once a month, get a mirror out, look at all the different cracks and crevices, make sure that you don't see something new on you. And if you do, that can be cause to have you come in to see the dermatologist.
It is amazing how important it is to be familiar with your own body. You know, we do a lot of topics on this show, and that is something that is sort of universal. And I think that's really important to remind our audience that looking at your skin and noticing what's new and what's changed is important. You know, Dr. Andolino, if a patient has been diagnosed with skin cancer and they are referred to you, how important is it for you to take your time and explain what the treatment will be like? It's such a foreign concept, fortunately, to most people, what radiation would be like. So tell me your approach to patients.
With radiation, you're right. It is such a foreign concept, and a lot of patients don't have a great understanding when we first meet of what will be involved. I find it's important that they are educated because they'll be much better able to handle any potential side effects if they know what to expect. And if they're better able to handle the side effects, they're more likely to stick with the treatment and more likely to have a positive outcome. I will often see patients that maybe they're not definitely even going to get radiation. They're there for an opinion to learn about radiation, and then they can make a decision that best suits them in terms of getting rid of the cancer, in terms of what side effects may be acceptable to them, or even just what fits best into their day-to-day schedule.
Yeah, the old adage, knowledge is power, is so important because there are a lot of options. And I think that that's important for the audience to know how many options are out there. You know, Dr. Wilson, what are signs and symptoms people need to be looking for? What's the most basic thing that you give advice to a patient saying, keep an eye on this?
Anything that's changing. That, you know, it used to look like something and now all of a sudden it's different. You know, we really worry for melanoma. We always ask, did it itch? Did it bleed? Did it hurt? So any of those characteristics of a spot on their body, we would recommend that they come see us really quickly.
So definitely do not be afraid to speak up. You see something, say something, and go see. So Dr. Krakowski, there's something called Mohs surgery, and I've heard about it. I know friends that have had it. I don't really know what it is. So can you tell us what it is, and when does a patient need it?
Mohs is actually the gentleman's name, general surgeon at the time. If you believe the mythology, as a medical student, invented this technique, and it's sort of been picked up by dermatologists, and it is a form of highly specialized skin cancer surgery. The idea is you're going back to the patient and you're cutting out only the parts of the skin cancer that you can see, you only go back to the spot that still has skin cancer. So for areas on the face or the ear, the hands, high value real estate areas, we like to say in dermatology, you want to take as little skin as possible, but you got to clear the skin cancer. That's the most important thing. Mohs surgery is proven to be the most effective means of skin cancer eradication. You can walk out of the office skin cancer free.
This is such insightful information from all of our panelists, but we're not done yet. After the break, we'll learn more about treatment options and recovery time. You're watching St. Luke's Health Now. Stay tuned.
St. Luke's knows that trust is the foundation of all relationships. It's earned over time. It's the type of relationship you should have with your healthcare team. While our healthcare needs are different, one thing is constant. St. Luke's is focused on building a lasting relationship with you, earning your trust and putting your well-being first. When it comes to great healthcare, trust is essential. St. Luke's, the care you trust, now more than ever.
My name is Taryn, and I was diagnosed with stage 3 melanoma. I recognized an issue with my skin. Probably it was in spring of 2020. I was pregnant with my second daughter, and I had noticed just after taking a shower that there was a mole that had regrown on my back. And I had previously had the mole removed in 2018. The biopsy said that it was benign. So when it came back, I didn't think anything of it, just noticed that it was back. So I was due for a routine dermatology appointment, and I also mentioned, by the way, this mole grew back on my back, and the dermatologist said, yeah, we're taking that one off. When I first heard that I had melanoma, when the dermatologist called, it was on a Sunday, and I knew that when a doctor calls you on a weekend, it's not usually the best news. So I was shocked when I heard that I had melanoma. I knew it was one of the rarest forms of skin cancer. When the surgical oncologist called me and told me that it had made its way to my lymph nodes in microscopic amounts, I think that was probably the point where I had, the worst reaction. After that, I met with Dr. Wilson, and the treatment plan was, in addition to doing active surveillance and getting blood work every month, I decided to do adjuvant therapy. So basically an infusion. I go once a month for a year to hopefully keep the melanoma at bay if there is anything still in there. I'm thankful for Dr. Wilson and for St. Luke's because it's not as if you're just another patient. Dr. Wilson has gone out of her way to answer small questions that I have, and she takes the time to call me, ask me how I'm doing, ask me if I'm having side effects, etc. And it's just a nice personal touch and makes you feel cared for. And the same with the St. Luke's staff, especially in the infusion group. They're just very friendly and very caring, and I appreciate that.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have had an intriguing show for you tonight so far, but we're not done. We're talking about melanoma and skin cancers. So in case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Wilson, Dr. Kakowski, and Dr. Andolino. Thank you all for being here. We've been having a great conversation, learning a little bit more about how to check for skin cancer, when you should see a dermatologist, and what role radiation oncology plays. So now we want to talk more about treatment options and technology. So Dr. Andolino, I want to start with you. What's the role of oncology and radiation in treating skin cancers, and what kind of radiation therapy treatments are available, things like 3D bolus? What's something patients need to know about how many options are out there?
At most cancer centers, including St. Luke's, if someone is going to receive radiation, they'll receive what we call external beam radiation, meaning the patient will be laying on a table and there's a machine up above them that's essentially shooting X-rays at the target on the skin surface. And the radiation, when it's coming from the machine and it goes through the surface of your skin, it doesn't really get to full strength until it's about like half an inch below your skin. What we have the ability to do now is we can take a scan of whatever skin surface we want to treat. That scan gets sent to a computer, and then we use a 3D printer to make a custom bolus or custom material that will be placed on the surface of the skin every day. And that bolus will fit like a glove right onto the surface of the skin. And it gives us a lot more confidence that we're delivering the amount of radiation that we know is necessary to get rid of the cancer.
I would imagine, Dr. Wilson, that some of these things come about because of clinical trials and that you are passionate about that. So can you tell us a little bit about clinical trials that are available at St. Luke's and for patients with melanoma and other things that people might be interested to know, that St. Luke's is actually doing trials that are helping come up with treatment options for patients, on a regular basis?
I mean, certainly here at St. Luke's, we have the standard of care that patients receive, either immunotherapy or targeted therapy. However, some patients don't respond to those. So the next steps really are some experimental and novel therapeutics. So we have a number of clinical trials that are opening that look just at that, the patients who have had standard of care, but who are now refractory to standard of care or non-responsive or progress later on. And one of the big things that we are trying to open here is something called tumor infiltrating lymphocytes. And this is taking a patient's tumor, harvesting the white blood cells that have already started to attack the melanoma, and expand these in culture and activate them and then reinfuse them back into patients. And it's something that has resulted in amazing outcomes for patients when you're talking about second or third line therapy.
Speaking of advancements, Dr. Krakowski, tell us a little bit about laser therapy and how is that used to prevent scarring? You mentioned the high real estate areas, right? Face, hands, neck, and people are very concerned, right? Of course you want to treat it, but it's something that I would imagine people have a lot of questions about. So tell us a little bit about laser therapies and how are they helping patients recover?
At St. Luke's Dermatology, we want you to look and feel your best. For those patients who look in the mirror, or for those patients who just want to make sure that they don't look in the mirror down the line and see some remnant of that procedure, we do offer a laser sort of menu, if you will, that's available to treat the specific characteristics of the scar that you may or may not like. Most often, what we're looking at is a textural difference for the scar compared to the normal skin. And there's another laser, this one's called the fractional CO2. It's very expensive, and we're lucky enough to have one here at St. Luke's, that we can sort of retexture the surface of the skin as part of the standard Mohs procedure that we offer. And it's something that we're very proud of because most places just simply don't have access to this very expensive hardware.
It's really amazing how much is accessible to patients here. And often, I think the first step is making sure that they get through the door, Dr. Krakowski, as you brought up earlier. But once they're through the door, regardless of what their care is or what their treatment plan is, Dr. Andolino, can you just tell us how the communication works on the team? What is the Melanoma Tumor Board, and how do all of you communicate to make sure that patients are receiving the personalized care that they need and that they deserve?
We do all work together as a team, and that really helps facilitate things for the patients as well as makes our lives easier if I can just pick up the phone or text Dr. Krakowski or Dr. Wilson. And it's invaluable to me to get Dr. Krakowski's feedback or Dr. Wilson's feedback because there's not always just one right answer. And so it really helps just make the process run seamlessly for the patients from the second they walk in the door and leads to better outcomes.
Thank you all for such engaging conversation. Up next, questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
My name is Megan Augustine. I'm the simulation director for the network. The Simulation Center is a safe environment where clinicians, non-clinical staff can come and practice their skills, learn new skills. A couple years ago, we got our first printer, and we started using that in the Simulation Center for molds and some prototypes. We were approached a couple months ago by the oncology department for us to try the 3D printing. So instead of going out and purchasing some additional hardware, they approached us and asked us if we can go ahead and start printing these 3D printed bolus. So with 3D boluses give better dose distribution for treating tumors just beneath the skin. So what they do is they will scan the patient and take that CT scan, and then using specialized software, they will go ahead and segment, based on a specific patient image. And then they send that file to us. And each patient scan is unique to that patient. Once we get that file, we will add some supports to that specific 3D image. We send it to our 3D printer, and then we print it. Once we print it, we'll then go ahead and take off those supports. We'll sand it down, make sure that it's smooth and ready for that fit to that patient. That 3D printed part will fit that patient's body image that was scanned so that treatment can target that specific area. The innovation and the technology, it's here to stay, to see what we can do with not just, 3D printing, but other technologies within healthcare. It's only going to grow and get better, and we have to kind of embrace it. It's one thing that I like about St. Luke's. We're bold and we're brave. We're at the forefront of innovation and with our quality of care.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about melanoma and skin cancers and how they're treated at St. Luke's. Now we're going to read some questions from our viewers. Are you all ready? The first one here is, if I didn't wear a lot of sunscreen in my early adult years, am I at risk for skin cancer later in life? Dr. Krakowski, can you answer that one for us?
Depends a lot, in terms of where you live. How close to the equator, for example, have you spent most of your life? What altitude were you at? We know if you're at a higher altitude, you're getting more UV exposure. We'll start with a clean slate. You come in, we'll take a look at you and make sure the clock starts ticking when you walk through the door. It's never too late to start. Sunscreen, sun protective clothing, those can start tomorrow. There's no reason why you can't make a change today that benefits you for the rest of your lifetime.
I love that. That's such a hopeful answer because you always hear, well, it all happens when you're a kid and your parents didn't slap that sunscreen on you and so you're in trouble. So I like that hopeful answer. So thanks for that. So Dr. Wilson, I'm going to throw this one at you. How important is prevention and what are some ways that people can prevent sun exposure that's dangerous?
I really counsel all my patients on safe sun practices. So just like Dr. Krakowski said, hat, sun protective clothing, wearing sunscreen, SPF 50, put enough on to start with, reapply every hour to 2.5 hours, be in the shade if you're outside in the high sun hours. I tell everybody they don't have to be a hermit. They're allowed to go outside and have fun. So really instilling those habits and behaviors early on really is helpful. And then the one thing I have to say is I would stay away from tanning beds. It's really, it increases everybody's UV exposure. And we know UV exposure really worsens skin cancers.
Absolutely. And I have to just say, there are so many bronzers out there. I'm a big believer in bronzer lotions, bronzer creams, bronzer. So it's out there. All right, Dr. Andolino, we have a couple questions that I think apply to you. I'll kind of combine them together, but this is something you hear often. Can radiation cause skin cancer or any cancer? I know people who have been diagnosed with things like breast cancer and they're afraid to get the radiation because they believe that could cause other cancers. Is that true?
We counsel all of our patients, on the risks of causing a cancer from the radiation. And these risks tend to be quite low, somewhere in the vicinity of 1 in 1,000 to 1 in 10,000, depending on the scenario. We prevent or cure infinitely more cancers than we cause. That's why we still do the radiation, even though we know that it can cause a cancer.
I think that's really important for people to talk to their physicians and figure it out. Dr. Krakowski, I'm going to throw this one at you. Does skin cancer run in the family? Is it genetic?
Within the world of melanoma, there are certain mutations that can be passed from family member to another family member that can be linked to melanoma and can cause melanoma, along with, bad news, other cancers like pancreatic cancer or breast cancer. So absolutely. And that's why it's important to have a physician who can actually take the time to listen to you, get a little bit of story, not just about you as a person, but what has been happening in your family over the last couple of generations. And that all becomes part of the management plan. We take all that into account.
Dr. Wilson, we have time for one more. I'm going to throw it to you, which is, if I have a cancerous mole, will it spread to other parts of my body?
We know that early stage melanoma has the least risk of spreading, and at that point, surgery can be completely curative. Get your skin checks regularly, and anything that's different, anything that's changing, anything that's new, call right away. Come in to see us.
Thank you all for being a part of the panel and giving us such insightful information, and thank you to all of you for watching. For more information on melanoma and skin cancers at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.